I'm Kathy, and today I'll be demonstrating how to insert an NG tube. So I've already checked the healthcare provider's order and confirmed the indication for NG tube placement. So here are the supplies that we'll need: a 15 French NG tube, a pen light, gloves, 60 ml syringe, emesis basin, lubricating jelly, pH test strip, a cup of water with a straw, tissues, a towel, tape, safety pin with elastic band, a specimen cup, basin of warm water, and a stethoscope. And we verified that our section is working and in order. So now I'll enter the room and close the curtain for privacy. I'll perform a hand hygiene and put on clean gloves. Okay, hi, I'm Kathy and I'll be your nurse today. Can you please verify your name and date of birth? Great, thank you. So the doctor ordered an NG tube to help empty your stomach, and you may feel discomfort, but I'll guide you through each step and stop if you need me to. Okay, now I'll raise the bed, the head of the bed into high Fowler's position, and place a towel across the patient for protection. Okay, now I'll assess both nares with a pin light for redness, irritation, or deformities. Okay, can you breathe in through one nostril while you cover the other? Now switch sides. Perfect. So we will use the nostril with better airflow. Okay. Now I'll measure from the tip of the nose to the earlobe and then down to the xiphoid process. And then I'll mark the length with the tape. Okay, now, and let's say it's 50 centimeters. Okay, so now I'll lubricate the tip of the tube with a water-soluble jelly. Okay, so please tilt your head back, and I'm gently inserting the tube into your nostril, aiming straight back along the floor of the nose, and I will pause if the patient gags. And once the tube reaches the back of the throat, tuck your chin to your chest and begin sipping water through the straw. And I'm going to advance it 2 to 4 inches with each swallow until we reach 50 centimeters. Okay, so now that the tube is in, I'll check the placement by aspirating stomach contents of about 5 to 10 ml with a syringe and testing the pH, and it should be between 1 and 5. Okay. And since this is not a real person, it won't go through all the way, but it should be until here. Okay, if the placement is uncertain, we would stop, remove, and restart. But if confirmed, I will tape the tube to the bridge of the nose and secure it to the gown using a safety pin and elastic band. Okay, so next I'll lower the bed and an x-ray may be ordered to verify the tube placement. If the provider ordered suction, I'll attach the tube to low continuous suction and make sure all tubing remains patent and unclamped. I'll monitor the drainage and document the amount, color, and consistency. And since I'm done, I'm going to remove my gloves. I'm going to perform hand hygiene and make sure the patient is safe, comfortable, and in a low locked bed position. I'll document the procedure, including patient response, tube placement confirmation, and output characteristics.